Cromolyn sodium is an anti-inflammatory drug, and it is also used for long-term asthma control. If you think about it, it's going to, when you have an asthma attack, your lungs are all inflamed, and so it helps that go away. It can be given intranasal for allergic rhinitis like an antihistamine, and it's just going to um, take those inflamed tissues and help them where you can get more air in. That one's not a hard one. Okay, we're going to keep moving on. And now we're going to look at digoxin. Digoxin is used to strengthen and slow your heart rate and manage dysrhythmias. So if your heart isn't beating properly, we're going to slow it down and strengthen the push. It lowers your heart rate, so you have to check that apical pulse for 1 full minute, and if it's under 60, you're going to hold. You're also going to check for potassium. Potassium is very important in digoxin's function, and so if you have a low potassium, it could cause toxicity. If you have a high potassium, digoxin is not going to function properly. Potassium's normal range is 3.5 to 5. You have to check potassium levels. The half-life is very long. It lasts for a day and a half, and that increases the potential toxic effects because it's not getting out of your system. Like other drugs in 6 hours might be completely out. No, this one's staying for a day and a half. If you do have toxicity, you're going to need the antidote, and the antidote for this medicine is digibind. Okay, the side effects of course, are always nausea, vomiting, but you're going to look for on this one vision changes. If you start seeing halos or blurred or yellow vision, you want to let your provider know. It could also cause leg cramps and muscle weakness. The therapeutic range is 0.5 to 0.8. Okay, your story for digoxin. A patient has dysrhythmia. Their heart is not beating right, and so they're given digoxin. The labs are run to monitor their potassium, and you're checking that apical heart. And make sure you're doing it for the full minute, and then you're going to hold the medication if it's under 60. The half-life is a day and a half, and that increases the toxic effects. You have to watch for vision changes, seeing halos, blurred vision, yellow vision, and you're also watching for leg cramps and muscle weaknesses. Digibind can reverse an overdose in the toxicity of digoxin. Okay, now we're going to look at laxatives. So, docusate sodium treats constipation. So if you think about it, you're backed up, and we need to get that out. So if you are like following your grandma's advice and you've been using mineral oil, you do not want to be using the same because it's keeping the doxysate sodium from being absorbed, and it can damage your internal liver. So that's really important. Don't be using mineral oil with this. But note to self, docusate sodium can be used too on compacted earwax. It breaks that up. So if I'm talking to the patient, you might, very rare, it causes rectal bleeding, but more than anything, it can cause your normal GI issues. But you want to this is a stool softener for mild constipation. It's allowing the fat and water to enter the stool and to soften it up. It can take 1 to 3 days to work orally or 5 to 20 minutes if it's used rectally. A constipated patient is given docusate sodium, and we're going to make sure that the patient hasn't been using any mineral oil and knows not to because it could damage their internal organs. Given orally, they can result in 1 to 3 days, rectally 5 to 20 minutes. It may cause GI upset, not something to worry about. Very rarely may cause some rectal bleeding. Okay, so polyethylene glycol 3350 is also a laxative, and normal nausea, vomiting, abdominal bleeding, cramping, flatulence. High doses may cause diarrhea. That makes sense. If you give too much of it, it's supposed to make you go. It may make you go a lot. Bowel cleaning solution, and it usually starts within an hour after taking it. Now, the book said 2 to 4 days. I don't think that's right. Maybe it said 2 to 4 hours and I read it wrong. It should be gentle to avoid dehydration. Make sure you're drinking lots of water. With any laxative, you're going to want to increase your fluids. So a constipated patient is prescribed polyethylene glycol 3350. What is it? A laxative. What is it used for? Constipation. High doses can cause diarrhea, and it may start as early as an hour. You're going to drink lots and lots and lots of water with this medication. Okay, naproxen. Naproxen is an anti. Okay, so we're switching gears now. Now instead of a laxative, we are looking at anticoagulants. So this one is a low-weight heparin. It's used for the prevention of deep vein thrombosis or pulmonary embolisms. It's used after surgery. Now, naproxen comes in a pre-filled syringe. Think of that X. X gives you two things. It's given in the love handles, and don't take the air out of it. It's going to have air bubbles. That's okay. The X, don't take the air out. And you don't want to massage the site. And it inhibits factor 10A. I don't know if you need to know that. Okay, so naproxen, the patient is at risk for developing a DVT after surgery or maybe for having a pulmonary embolism. So therefore, the blood needs to be thinned. So naproxen is prescribed. Ask the patients if they have a sensitivity to pork or cow because that's what naproxen comes from. It's actually made from the pork intestines or the cow lung. So, and maybe even I mean, if you're thinking about it, a Muslim or someone that's a Jew may not want to have that if it came from it came from a pig. You want to be sensitive to their cultural standards. Make sure that it is administered in the love handles and don't massage it afterwards, and keep the bubble in the shot when administering. Okay, so heparin. Now, what does heparin do? It's an anticoagulant, so it's going to thin that blood and reduce your chances of having a clot. You need to draw labs to make sure to check the therapeutic levels. Of course, there's a bleeding risk because you're thinning the blood. So you're monitoring signs for bleeding and platelet counts. So you're telling that patient, hey, you're not going to want to shave. You may be seeing some bleeding, bruising, but you really want to report any redness in your eyes, tarry stools, or bruising. You want to give it in the belly button in that fatty tissue. Most patients might have it in the hospital if they're going to be there for more than 3 to 5 days to keep them from getting clots because they've been laying down so long. Hot blend are they? Now this one doesn't actually thin your blood, but it keeps it from clotting, and it's given around every 8 hours. And if there is an overdose, you're going to treat it with protamine sulfate. Protamine sulfate is what you're going to treat if you get too much. Okay, so this is going to end video 3, so next will be video 4.